First aid is the emergency care given to an ill or injured person before medical help arrives. The goals are to prevent death and prevent injuries from becoming worse. In an emergency, the emergency medical services system is activated. In most places, it's 911. I was reading yesterday, the American Safety and Health Institute put out their latest newsletter, and in it they said that almost every place in America has 911 access now, but there's still a few that don't. But it's much more available than it was 10 years ago. If you don't have 911 access, you can call the fire department, the police department, or even a phone operator. To activate EMS, call 911, fire or police department, phone operator. In nursing centers, the nurse will decide when to activate EMS. Know your center's policy about CPR. We've talked a little bit about that. If the person in their advance directives say they don't want any heroics, they don't want anything done when their life ends, they want to be left alone. And that's fine, they have that choice. But if they want everything done, then the facility will initiate the CPR, and then EMS will arrive and take them for further treatment. The nurse will tell you how to help. If a person has stopped breathing or in sudden cardiac arrest, the nurse may start CPR. Basic life support, or BLS. These procedures support breathing and circulation. The American Heart Association's basic life support courses teach the chain of survival. The chain of survival actions for adults. First, early access to emergency cardiovascular care. That means the first thing you do is call 911. Followed by early CPR, early defibrillation, and early advanced care. Start CPR, send for a defibrillator if there's one available, and get them to the ER as quickly as possible. And forgive me for saying ER because now everybody says ED. It's no longer emergency room, it's now emergency department. So if I say that, or if I say patient instead of resident, it's because I'm old. Okay, cardiac arrest. Sudden cardiac arrest or cardiac arrest occurs when the heart and breathing stop suddenly without warning. There are three major signs of SCA. No response, no breathing, no pulse. Respiratory arrest occurs when breathing stops but heart action continues for several minutes. But if breathing is not restored, cardiac arrest will occur because that oxygenated blood is going to become depleted. CPR, cardiopulmonary resuscitation. When breathing and the heart stop, the person is clinically dead. CPR must be started at once when a person is in sudden cardiac arrest. CPR supports breathing and circulation. The CABDs of CPR start with chest compressions, open airway, breathing, and defibrillation. The chest compressions and open airway breathing procedures are done until the defibrillator arrives. As soon as the defibrillator tells you, do not touch the victim, analyzing rhythm, everything stops. You don't do anything until the defibrillator tells you what to do next. Chest compressions. Circulation. Chest compressions force blood through the circulatory system. Before starting chest compressions, check for a pulse. Use the carotid artery on the side near you. It's in the neck. Also, look for signs of circulation. See if they started breathing. See if they're coughing, if they're moving. For effective compressions, the person must be supine, that means on their back, on a hard, flat surface. So if you find the person in a bed or they're laying on a couch, move them to the floor or put a hard surface under their back, because the whole premise is to mash their heart between the sternum and the spinal column. That forces blood into circulation. If they're laying on a soft surface, when you mash their heart, all you're going to do is mash their body into that soft surface. They must be on a hard surface. American Heart recommends you give compressions of at least 100 to 120 a minute. Push hard and fast. Push deeply into the chest. For the adult, it's 2 to 2.4 inches deep. Interrupt chest compressions only when necessary. Airway. The respiratory passages must be open to restore breathing. The head tilt, chin lift method opens the airway. Tilt the head back, bring up the chin, and that helps move the tongue away from the back of the airway. Breathing. The person is given breaths. Before giving breaths, check for adequate breathing. When you start CPR, Your book tells you to give 2 breaths first. American Heart says no, start with compressions. So you'll actually start with compressions. 30 compressions, 2 breaths. Mouth-to-mouth breathing is one way to give breaths. Mouth-to-barrier device is another way of giving breaths whenever possible. You'll have a shield that will go over the person's face, over their nose and mouth, with a stem that you can breathe into to give them breaths. Or you may use an ambu bag if you have another person helping you. Defibrillation. Ventricular fibrillation, VFib or VF, is an abnormal heart rhythm that causes SCA. If the person is in ventricular fibrillation, the heart is laying inside the chest, jiggling. It can't catch a beat. It can't force blood out. It's just shaking. And the purpose of the defibrillator is to shock it back into normal rhythm. Defibrillate as soon as possible after the onset of VF to increase the person's chance of survival. CPR is done only for cardiac arrest. The person does not respond, they are not breathing, they have no pulse. It can be done alone or with another person. Hands-only CPR is used to educate people not trained in basic life support. So if you come across a person who is not breathing, they don't have a pulse, if you don't feel comfortable putting your mouth on them, at least if you do compressions, you greatly improve their chance of survival.
You should you only do it if you have your CPR certification?
If you've been trained, you don't even have to have a certification.
Just as long as you've been trained.
As long as you've been trained. Most healthcare entities require you to be state registered, American Heart certified, to be able to demonstrate, to use CPR. I have a friend who called me the other day. She's a nurse, and they told her, if you don't have your CPR by the end of April, we're taking you off the floor, because it's a requirement. They have to have it, just like they have to have their license. The recovery position, when the person is breathing, they have a pulse, but they're not responding, they're still unconscious. The recovery position, you turn them onto their side. And on page 660 is a picture of the recovery position. So you can turn them on their side with their thigh and their shoulder. A lot of times you can support their head. Before you roll them over, you might bring their arm up to the side of their head and when you roll them over, that puts their face on their arm. Or you can raise their arm straight up, so when you roll them, their face is on this arm, they're not on the surface. And that also helps keep the airway open if you're supporting their head when they're on their side. But you turn them into the recovery position to keep the airway open. And if they should regurgitate, it'd be more likely to run out of their mouth instead of back into their airway. Log roll the person into the recovery position. You turn the whole body as a unit to keep the head, neck, and spine straight. Their hand supports their head. Do not use this position if the person might have neck injuries or other neck or head trauma. And the defibrillator is pretty much dummy proof. This is a trainer. This won't really shock you, but it works the exact same way as the one that I saw at the Opera House, Bluegrass Airport, Rupp Arena, Fayette Mall, and it will tell you what to do. A lot of them, when you open it, it'll turn on by itself, but it has to be turned on before you do anything else. This one, you have to turn it on with a button.
Remove clothing from the patient's chest.
The chest will be cleared.
Open packet and apply pads onto...
While the machine is talking and your partner is taking this apart and applying it, you're doing CPR without stopping until the machine tells you, do not touch the victim, analyzing rhythm. Then you stop your CPR, trade places with your partner, because you've been doing compressions and you're tuckered out. So they can take over compressions while you do breaths with the ambu bag. But it even has pictures to show you where the pads go on the person's chest. So one will go on the upper right chest, one will go on the left rib cage. The premise is to shoot electricity from one pad to the other, so it goes straight through the heart. If the person is very small and you're afraid they might overlap, you can put one on the front and one on the back, so it shoots through the body to the other pad to give that shock to the heart. Okay, the next emergency care would be hemorrhage. The excessive loss of blood in a short time. If bleeding is not stopped, the person will die. With internal hemorrhage, a lot of times you don't even know. Bleeding is inside body tissues and body cavities. Sometimes they might vomit blood or expel it through a body orifice. With external bleeding, and it's not hidden by clothing, it's usually seen. Bleeding from an artery occurs in spurts. Any place on your body that you feel a pulse, that is an artery. Arteries are bringing fresh blood out of the heart and into circulation. So if you cut an artery, it's going to squirt out. If you're bleeding from a vein, it'll be a steady flow of blood. That's deoxygenated blood going back to the heart. So it's different kinds. And these blue things you see, these are veins. But wherever you feel a pulse, that's an artery. Next is fainting. Oh, I'm sorry. So if they do have bleeding, excessive bleeding, direct pressure. So if you have a washcloth or a bandage or whatever you have to apply direct pressure over that person's wound, hold it there until the bleeding stops. If that washcloth becomes saturated with blood, get another one, put it on top of that one. Don't move the first one because it might be trying to clot. Put another one on top of that one. If bleeding does not stop in a reasonable amount of time, put pressure on the artery above the site. And there's pictures on page 661 as examples of where you might, which arteries you might apply pressure when they're bleeding from those different limbs. And once you get it under control, bind it until you can get them further attention. Okay, now fainting. The medical term for fainting is syncope. It's spelled S-Y-N-C-O-P-E. It looks like syncope, but it's pronounced syncope. Fainting is a sudden loss of consciousness from inadequate blood supply to the brain. The person is pale, they have a weak pulse, and shallow respirations if consciousness is lost. If the person tells you they feel like they're going to faint, the first thing you should do is get them off their feet. Usually the fall hurts them worse than whatever caused them to faint in the first place. So get them off their feet, sit them on the ground, whatever you need to do. Have them lean forward, put their head between their knees. If they're lying down, elevate their feet. And don't let them get up after they regain consciousness for at least 5 minutes.
Can medicines cause you to faint?
Yes, a lot of things can cause you to faint. Medicine that causes drowsiness can. If you have too much thyroid medicine, it can throw you into overload and you'll pass out. So there's a lot of things that can cause fainting. Shock. Shock results when organs and tissues do not get enough blood. It can be caused by blood loss, heart attack, burns, severe infections. Signs and symptoms include low or falling blood pressure, rapid weak pulse, rapid respirations, cold, moist, pale skin, thirst, restlessness. They may develop confusion or even loss of consciousness as shock worsens. Shock can also be caused by pain, and it could be caused by fear even. Anaphylaxis. Anaphylactic shock occurs when people have severe allergies to certain foods, insects, chemicals, medications. An antigen is a substance that the body reacts to. Anaphylaxis is life-threatening sensitivity to an antigen. It can occur within seconds. Anaphylactic shock is an emergency. EMS must be activated. Typically, when it starts, the person might break out in a rash. They might break out in a sweat. Their airway, their mucous membranes will begin to swell. They can't breathe, and they could actually die. And my daughter has this allergy to fish. She carries an Epipen because it happens. Twice we've had to use the Epipen because her airway was closing so quickly. The first time she had it, and she developed this allergy when she was 22 years old. She had never been allergic before. So, and that happens. You can become allergic or not allergic to something anytime in life. But she luckily was working at Central Baptist Hospital, and she called me. We'd eaten at a Japanese restaurant, and I could tell by her symptoms when she was talking to me on the phone. She said, I've broken out in a rash. My skin is all itchy. And then she started to clear her throat. I realized her throat was swelling because while she was talking to me, it was, I don't know what's wrong. I don't know what's wrong. And I said, get to the emergency room quick. Well, evidently the nurse sitting next to her, she said, what's wrong with you? And she said, I don't know. My mom thinks there's something wrong. She gave her the phone and I said, she's having an anaphylactic reaction. They threw the phone down, rushed her down to the emergency room. They loaded her up with epinephrine and prednisone. And thank goodness was able to reverse the reaction. But it happens very, very quickly. If you know anyone who has this type of allergy, they should always carry an EpiPen. If they can't give it to themselves, you give it to them. To do that, you pull the tip off of the pen, slam it into their thigh. You'll feel a click when the needle activates and administers the medicine. When it's finished, wait about 3 seconds, pull it out, and rub that area as hard as you can to get the medicine into their system. If they don't start to recover in 5 minutes, give them another shot. And hopefully ambulance will be on the way. But it is an emergency. The person needs special medications to reverse the allergic reaction. And they should always carry that with them. And a medical bracelet or necklace to let people know. The next disorder is stroke or cerebrovascular accident or CVA. Stroke occurs when the brain is suddenly deprived of blood supply. It could be caused by a thrombus or an embolus. Thrombus and embolus are both blood clots. The thrombus is a blood clot that stays where it develops. An embolus is a blood clot that moves. Most of the time, it's going to lodge in a vital organ. The brain, the cerebral embolus, the heart, a coronary embolus, or the lung, a pulmonary embolus. And you can die. Stroke can also be caused by hemorrhage. A blood vessel in the brain bursts. It's usually caused by an aneurysm, a weakened spot in that vessel that bursts, and it's spilling the blood into the cranial cavity and not into the brain itself. So the cause of the stroke, the brain is suddenly deprived of the blood supply. Signs of stroke depend on the size and location of the brain injury. And your brain sits in your head backwards. If the left side of your brain is affected by the stroke, the right side of your body will be affected, and vice versa. The main thing you can do is keep them safe until emergency help arrives. Seizures or convulsions, violent sudden contractions or tremors of muscle groups, they're caused by an abnormality in the brain. A single seizure does not mean epilepsy. It can be caused by many things. It could be caused by fever. It could be a reaction to a drug. It could be because of maybe you have the flu or maybe you've had a stroke. So a lot of things can cause seizures. If they have epilepsy, they have a brain disorder in which clusters of nerve cells signal abnormally. There are brief changes in the brain's electrical function, and if the person is diagnosed with epilepsy, the seizures will recur. There's no cure for epilepsy at this time, but there are medications to curb the frequency of the episodes. And for some people, they work very well, and for other people, they don't work at all. The major types of seizures, the partial seizure, only part of the brain is involved. They may not even lose consciousness. Excuse me. The generalized tonic clonic seizure, that's the grand mal seizure. It has two phases. First, the tonic phase, the muscles tighten, the person usually loses consciousness, and then the clonic phase where the muscles start to twitch and react. The general absence or petit-mal seizure, they may simply lose focus. You may be talking to them and suddenly they look like they're lost in thought, but then they come back. So there are different types of seizures. You cannot stop a seizure. All you can do is protect the person from injury. And regardless of what you heard, you don't put anything in their mouth. That can cause more damage than anything. If you're able, get them onto their side and stay with them to help keep them protected. Move anything out of the way that they may be striking and hurting their skin, and try to protect their head if you can. I had a student last summer, he said he was at the mall, Fayette Mall, in a checkout line in a store, and the lady in front of him said, "Do you know what to do if someone has a seizure?" He thought it was a joke, and he said, no, what do you do if someone has a seizure? And she said, I'm about to have one, please protect my head. And she fell out with a grand mal seizure. And he said he was so afraid, but he flopped down on the ground and just held his head in his lap until the seizure was over. And he said it was so scary that he'd never seen anything like that before. But that's all you can do is protect them while it goes on and try to keep them from being injured.
Can a petit-mal seizure like progress into a grand mal seizure like at one time? Like can they go from that just phase to having unconsciousness and then the twitching, or?
Typically they don't, but I don't know, because normally whatever type of seizure they have is pretty consistent.
Yeah.
But I would think if they were known to have grand mal seizures, there's a chance they could have the petit-mal. But if they only have the petit-mal as a diagnosis, I don't think they would. But you never know, because there's something wrong there to begin with.
Yeah.
I'd say there's a potential. Burns. We talked a little bit about burns when we talked about electrical safety. Burns can severely disable a person, and they can even cause death. Most burns occur in the home. Infants, children, and the elderly are at the greatest risk. Burns are described as first degree superficial, partial thickness are second degree, and full thickness are third degree burns. The superficial burn involves only the epidermis, like a sunburn. The partial thickness second degree, the epidermis and part of the dermis. The full thickness third degree burn involves the entire epidermis, the dermis, it can even go to the bone. Nerve endings are destroyed, so the full thickness burns, if that's all you have, are not as painful because the nerve endings are gone. But they are all very susceptible to infection. The severity depends on the burn size and depth, the body part involved, and the person's age. Do not touch the person if they're in contact with an electrical source. Have the power source turned off or remove the electrical source. Use an object that will not conduct electricity. Rope, wood, paper, something to push it away to remove the electrical source, because you don't want to get shocked as well. And if they do have burns, you want to cover them with cool, moist cloths until you can get them further attention. Quality of life. Protect quality of life during emergencies. The right to privacy and confidentiality. Protect the person from onlookers. I was in a situation, I worked with a nurse who tried to commit suicide at work. She drank 30 cc's of morphine, liquid morphine. And when I found her, her airway was completely closed. She was not breathing. She did not have a pulse. So I zipped into the room, yelled for the PA to come and help me. We got her intubated, got CPR going, and I looked up and realized the entire staff were standing there watching us while I had ripped open her shirt to do compressions. And I realized she was exposed in front of all these people she knew. So luckily I was able to take my foot and kick the door closed because there was nothing they could do. And I know they were concerned, but I realized she was my friend and I knew she would not want her coworkers to see her like that. So try to provide as much privacy as possible. Protect them from onlookers. Protect the right to personal choice. Protect their personal items from loss or damage. I helped a lady in the mall having a seizure, and when she woke up, my daughter at the time was very small, and EMS got there. I told them what happened. They loaded her on the stretcher, and they were taking her away. And my daughter at the time was 5 years old, and she goes, "Mommy, her purse." I said, "Oh, wait, we've got to give you your purse." So try to pay attention to those things. It is important. And always promote physical and psychological safety. And the right to personal choice also applies. I mentioned that. I forgot to tell you. At church a few years ago, we had a man have a stroke in church. So the youth minister yelled for me, "Come and help." So I got there, and he just kept saying out of the one side of his mouth, "Get me out of here, get me out of here." So we loaded him up in the stretcher and got him outside. And EMS got there, and they said, "We're taking him to Little Joe on Richmond Road." And I told them he doesn't want to go there. He wants to go to VA. He has no money. He has no insurance. All he has is VA. And they said, "But we have to go there. It's closer." "No, you don't. He wants to go to VA." And they said, "Okay, when you call his wife, tell her we're going to VA." So they took him to VA because they do have a right to personal choice. And luckily, he had very little residual after it was over. He was able to walk with a cane. He just had weakness in one side. So that was a good thing. Choices are few in emergencies, but they're given when possible. They have a right to choose their hospital. They may even choose to refuse care, and they can do that as well.